Good.
Dr. Lucy Caratti. How are you?
Good, thank you. Thanks so much for having me.
It's such a pleasure. And I think so. Maybe it's my personal interest, but I feel like I don't actually think it's just me. I think it's everyone is so much more invested in learning about hormones as we age, before children, during children, after children, because it certainly becomes apparent that life gets a little bit tougher as you start to age, in the body of a woman. It's just really complicated and not
Definitely.
linear.
And I think people now are not putting up with it. I think our parents' generation and definitely the generation before then, people just kind of suffered through this time of life, and it's quite exciting that we're all talking about and actually working out what's going on and how we can help ourselves and not putting up with this suffering age of
Mm.
perimenopause, menopause.
So you are a women's health practitioner and you are very much loved in the space of really advocating for awareness about perimenopause and menopause and hormones in general. So you are the perfect person to have on and talk us through all of the bits and bobs. But I'm so curious, and you actually have a podcast of your own, which I've just had here because it's called Goddess Era, and you host it with phenomenal women. So I'll definitely link it in the show notes because I think there's some conversations on there. I've listened to a few and they cut through all of the noise and just really answer the questions that I'm sure are common to so many women. So
Definitely.
you've got a lot going on and you're a mum and you've just got back from a big trip and you're on a podcast first thing with me this morning. So I hope you have a coffee in reach.
I've had one already, definitely. But, anytime I can talk about perimenopause and menopause and just kind of shine light, I'm here. I love doing it. So it's a pleasure.
Well, the first word we ask, we always love to ask our guests the first word they think of when they hear a particular phrase. So I would love to know, what is the first word you think of when you hear the phrase hormonal?
Oh, annoying. I think because it becomes so derogatory and it's sort of like putting women down, being, oh, they're just hormonal.
Hmm.
We all have hormones. Men have hormones. Actually, women have more testosterone in our body than estrogen and progesterone. It just bugs me, this hormonal connotation as being it's a negative thing. Hormones are beautiful. They're chemical messengers in our body that are telling us what to do. So it's probably a bit too much information for the one word, but yes,
Yeah,
annoying.
I totally agree. I always find myself justifying a bad mood or when I'm slow or the brain fog. So, oh, I'm just hormonal. But it's so much more than that. There's so much going on because not only are you, controlling the exterior part of your life, your job, kids, social, all that. When you've got so much going on inside, regardless of what time of the month it is or where you are in life, your age, regardless of all that, just the fact that you've got so much going on inside on a chemical level it's unfair that we just say, oh, we're just on hormonal. We deserve more than that, so much more.
Totally. And I think you've hit the nail on the head that we're really a sandwich generation where we're having kids later. So back in
Mhm.
the day when you were having kids, even in your teens or early 20s, by the time you got to your 40s, the life expectancy usually wasn't as long and you weren't looking after elderly parents, but your kids had left home and you weren't looking after them, and women often weren't working. And while I love that we've got this opportunity to be doing everything, women in their 40s should be starting to slow down and start sort of looking inward at themselves. But we've got a generation of women burnt out,
Mm.
exhausted, sometimes caring for children, sometimes at the peak of their careers, maybe looking after sick family members, and then going through this recalibration of the body at the same time and wondering why they're not coping.
Yeah. I read so many articles about, especially now, just becoming far more interested in the perimenopause and menopause space, about women who have lost their jobs or resigned from their jobs or their marriage is split up or, they've had burnout.
Yeah,
So it's pretty dire. It's not just like it's not as, it's not just PMS that, I mean, even
yeah,
that's a flippant comment, but if it's changing someone to so much of an extent that they feel unable to be in control of their world and everything else, and they turn into sort of a different person, and That is so big. Like the fact that it's not talked about as much as it should be. Women just need more support and more awareness.
And I
And it's
think
not hard to
men
give.
as well, right? So if a woman is not feeling, the biggest things that they say are they're not feeling themselves. They
Mm,
don't recognize the body they're in. They're anxious for the first time. They've never had anxiety. They're anxious. Their
mm,
libido's gone.
mm,
So if she's basically just struggling and not having sex, and the partners, if the partners don't know what's going on, they just think the marriage is breaking down, and or they're going to be looking elsewhere, or they're not going to understand or be able to give the support that
mm.
they need to their partners. So I think it's awareness for everyone, and even in the workplace for the colleagues to know that if a woman's presenting and she gets a hot flush, that's okay. It's not. She might be, lose her concentration for a moment, but she's back on. It's not undermining their efficiency or their intelligence or their value in the workplace.
Mm. So I guess a great place to start, and we were talking about a lot of the listeners of the first word are between 34 and 45. So can you explain to us in simple terms what is perimenopause, which is getting a lot of airtime at the moment, which is great, but what is
Yes.
perimenopause?
And I think a lot of the time they're kind of used interchangeably, and that can be really confusing, but they're very different in that perimenopause is the time leading up to menopause. So your menopause is when you've had your final period, 12 months after your final period. You don't know it's your final one, but once you've had 12 months without a period, then you have reached menopause. So
Mm.
perimenopause is all the time leading up until that time. And it can be from 2 years beforehand up to 12 years beforehand. So it can really be this really large part of your life. And it's often actually the more turbulent time. So once you reach menopause, if you've sort of done a lot of things right and you're at a good stage, then menopause can become a lot more peaceful and you can get more energy and you can feel great. Whereas perimenopause is really the time where people are struggling the most.
Mm. With the earlier you said women are having babies later.
Mm,
So with that sort of 2-year postpartum transition when there's the body is still kind of recalibrating, so to speak, if
yes.
women are going through that postpartum stage in their later 30s
Mm.
and then potentially also entering into the perimenopause space, can that double up or does that become the same? Do all those things she'll feel become one, or is that woman, if she's in that space, going to get even more heightened
Yeah, it's a really
symptoms
good
of
question.
perimenopause?
And I think this is one of the main reasons why people take quite a while to realize that they're going through perimenopause, because postnatal depletion can last at a 6 years up until after your last baby. So it's very often that people are going from that postnatal depletion straight into perimenopause. And I think that's where it's not this sudden change of symptoms, it's this gradual change. And if you're already burnt out and depleted, then you are going to struggle a bit more with perimenopausal symptoms. So definitely it goes hand in hand that it's not that it will all become one, but you may experience perimenopause uh, more severely.
So what is there a typical age that women start to become perimenopausal, or is it just dependent?
It can be really dependent. So the normal age to reach menopause, we say, is around 45 to 55. So that's 10 years that we
Mhm,
say is normal. If it's below 45, then it still happens quite a lot.
mhm.
And that's called premature menopause. And actually women in their 30s, even there are cases of women in 20s that are going through menopause. So it can happen at any time. And I just say, no matter what your doctor says, you're never too young to be
Mm.
experiencing perimenopause. It might not be, but it's not to rule that out straight away. So I generally find that late 30s to early 40s is when I see most people in my office starting to struggle.
Mhm.
So early 40s definitely, but as I said, from early 30s to mid 30s, you can definitely start to have some of these hormonal changes.
Do genetics play a part? Is it worthwhile women, if they're able to ask their mum, when did you go through menopause or perimenopause, if they were aware?
I think it's really definitely something interesting. And I always ask my patients, this is definitely not a hard and fast rule, but we do say your mum's menopause age plus or minus 2 years can be a rough indicator, but there's so many things that can play into that as well, from lifestyle to other diseases to diet, stress, all of these things that can actually play into it. But if someone knows that their mum or their sibling has gone through earlier menopause, we are on a bit more high alert for maybe the fact that you're going through an earlier menopause.
So on that, if a woman is really healthy, fit, eating the right foods, doing all those things, versus someone who's potentially not taking good care of themselves, maybe drinking, smoking, not exercising, carrying a bit of weight, is the latter woman going to potentially bring menopause forward?
Not necessarily bring it forward, but probably suffer through it a little bit more. So perimenopause is this recalibration of the brain. It's trying to reprogram to get you ready for a life with low hormones. So it means that your brain's really a bit more susceptible to stresses around you. So then when we talk stress, like talking about stress, I've got lots on. It's insulin. High insulin is one of the biggest stresses on the body, and majority of doctors wouldn't test that. We look at blood sugar, and so when the fasting blood sugar goes abnormal into a pre-diabetes or diabetes range, then we do something about it. But looking at your insulin is really important. But other stresses are not sleeping, not eating enough, not eating the right foods, eating too much of the wrong foods, exercising too much, not exercising enough. So all these things are stress on the body. And so we'll make that recalibration of the brain and all those neurological symptoms that happen with perimenopause a lot worse.
I love when you say the recalibration of the brain, because I think sometimes when you don't look at it that way and, you have a hot flash or a symptom of like a hormonal symptom or menopause or something, it is so easy to write off and, like we said, to say hormonal, but it is so nice to hear the words like your brain is recalibrating. Like there is such an intensity of change going on internally in your body, and it is remarkable what women can do with that going on. And despite that, and they can be like, women just astound me how much they put up with before they even they're just amazing at their ability to not only multitask, but just to always be so selfless and carry a real struggle at the same time.
100%. And actually, I've just been reading this amazing book called Goddesses in Older Women by Jean Shinoda Bolen, who talks about basically our patriarchal Western society from Greek times. We don't have these strong, powerful crone archetypes in our culture. Any woman that all the strong female archetypes were young, and then once they became old, they were either swallowed up or became invisible or became mad. And so if you look at all the other sort of more Eastern and ancient tribal, that reaching menopause was this really privileged time, and you became a clan mother or you became a wise woman. And so you were kind of re-energizing, and you were retaining your blood for knowledge. So when you get pregnant, you retain your blood to create a baby, and at menopause you retain the blood for knowledge. And then sort of starting to talk about more these hot flushes and as being power surges, being like getting yourself ready at that powerful time, which I love just reframing. We're so negative in our society about it, but if you just start changing some of the way we talk about it, it's so powerful for women.
Is there a relationship with hot flush and a spike in testosterone, or what's going on there? What is a hot flush?
Generally, it is when your estrogen is fluctuating. So the estrogen doesn't just kind of naturally go down, which is why it can be quite tricky to test for. It actually, at the beginning of perimenopause, your progesterone is the first thing you lose, and your estrogen goes 3 times higher than it ever has been before. And then it slowly kind of ups and downs erratically. So when you're going on a estrogen on the way up, you can get a certain amount of symptoms like heavy bleeding and headaches. And as it's coming down, as your body's sort of withdrawing from those estrogen levels, that's when you get the more typical menopausal symptoms like hot flushes and night sweats. And so it's actually that change in estrogen is affecting your thermoregulatory part in your body.
So they're great, because I was going to ask, what are the early symptoms or the most notable symptoms of perimenopause? So you've mentioned hot flushes, and what are the most common?
So I think it helps me to sort of think about and explain it in the stages. So you've got early perimenopause where, as I said, the estrogen is actually really high and the progesterone's low. And progesterone is like your body's chill pill. It's like your Valium. It's like calming. So the very first kind of symptoms are nothing usually very period related at all. It's often anxiety, poor sleep, feeling overwhelmed, feeling irritable, just unable to cope, not recognizing yourself as much. But then you can also get shorter cycles because your progesterone's in that second part of your cycle. So if it's less, you might be having periods every 3 weeks instead. You can also get heavier periods. Then as you start going to that later perimenopause, that's when the estrogen's also low. So they're the more typical menopause symptoms that we've heard about as hot flushes, night sweats. You can also get headaches, you can get migraines, you can get dry vagina, dry mouth, body aches. That's really a common one that people often haven't associated, like all their body is aching. And so then you start sort of skipping periods and your periods might become lighter at that time. Then it becomes, you might have 2 or 3 periods and then you have your final period, not knowing it's final period, 12 months, menopause. So you can see it's really chops and changes all the time, which I think is why it's been poorly understood and poorly managed in the past.
Yeah. When you say dry vagina, does that coincide with a low or a drop in libido?
It can do, because for females, obviously, if it's not comfortable, then that pain's a thing for you're not looking forward to the pleasure. But often, actually, after 40, your testosterone levels start to drop down. And that's not part of the menopausal change. That is just something that starts to happen and you can combat that. But that is one of the more common reasons why people have low libido. But then again, there's a bit of weight gain that happens. You're anxious, you're irritable. So it's a whole picture for libido. It's a harder one to tackle because it's often multifaceted.
Do men lose their libido as they age as well?
So men have a kind of andropause, but theirs happens so they have a peak around 19 of the testosterone. Then it slowly goes down to about 35, and then it pretty much stays at that level. They have lower, they'd never go to those really just about no hormone levels. But there's definitely sort of andropause that happens for them as well.
Yeah. Gosh, it's so funny when you compare the aging process of the male versus the female, because I've been with my husband for 14 odd years and we've, gone through lots. We've gone through the honeymoon stage, the breakup, the engagement, the kids. Anyway, I'm 34 and we were in bed the other night and I had my period and I'm there with like my period undies on, my hot water bottle because I'm crampy and my back hurts, and then a towel because I have night sweats during the first couple of days of my period and I've got 2 towels around. And I looked over at him and he's just like got his book and he's ready to go to bed. And I'm looking at him going, God, that looks great. Like, this is kind of fucked. And I'm not, I mean, who knows if I'm perimenopause or not, but it's just that, I don't know, that constant transition of hormones and your body changing and catering and pandering to this and that. It's just, it'd be so nice to get in bed and read your book and go to bed.
Happy as clams.
Oh, it's so funny. Like, God love them, but holy moly.
You've got women.
Because I often think, like, is it easy for them or are they also transitioning, but I'm not seeing it, or we're not? Are they going through some sort of change like us, but it's less, or what's going on with the aging man?
There's something that's happening, but it's definitely not nearly like what we go through. I think it's you're getting your period, you're trying to pretend you don't have your period, and you're trying to manage your period. And you often have a period of time where you're trying not to get pregnant. Then you're having a period of time trying to get pregnant for some people. Then you might get pregnant. Then you're dealing with perimenopause, then menopause. Like you're honestly dealing with something all the time.
Always.
Yeah.
My little boys love finding boxes of colourful tampons, and they take them and put them everywhere. So every month, first of all, bleeding every month is a pain in the ass. Like, it's great that your body is doing what it needs to, but it's just another thing we have to, look after. But then when they take all the tampons, I'm just in the bathroom going, oh my God, like, this is just another thing. I've got a lot to do, let alone find a tampon in my own house. So much. So to prepare our bodies, if, from women in their late 20s, early 30s, mid 30s, what is the best thing that we can do just to prepare our bodies so that when perimenopause and menopause hits, the blow is softened, so to speak?
So I think from late 30s, but definitely from 40, I ask all my patients, it's a really good time just to take stock of your health. Because actually one thing as well is it's not just about the symptoms that you're getting with perimenopause. It's also that perimenopause is like this critical health window. So it's a bit like fetal development and childhood, where certain things that happen at that time can set you up for other health issues later on. So if we, if say, for example, that insulin is really high, or you're there's a lot of inflammation in the body for other reasons, and you go through menopause without dealing with it, you have a higher risk of heart disease, Alzheimer's, anxiety and depression, type 2 diabetes, all these things. So it's actually, even if you're really healthy, it's a really good time just to kind of take stock of your health a little bit anyway. So I always recommend just either seeing someone that specializes in this area, or a GP that you feel is confident to work with you. Now, it might not be their specialty, but I think if you've got a GP that's open to listening and hearing what you are wanting and working with you, then I think that's amazing. And the blood test that I think is the most important to ask for is the fasting insulin. So you'll have to pay for it. It's a private test. But the blood sugar that they normally do, as I said, it's a late indicator. We use that medicine's really good at diagnosing disease. So we wait until that reaches pre-diabetes or diabetes, and then we do it. Whereas the insulin changes a lot earlier. So having a look at that, we want that between 4 and 6. I think the normal range for the lab is below 20, but that's because that's when it's reaching diabetes. So 4 to 6 is optimal. And then if it is higher, working with someone that knows nutrition to help you address what you're eating and how you can get that down. But otherwise, the other thing that's really important from 40 is starting to do some muscle mass kind of exercise, so weight-bearing exercise. We're in a culture of really doing a lot of HIIT kind of training, which is great. It's really good for our cardiovascular health. But switching more to a weights-based training and really building up your muscle mass for your bone health, but also just for your muscle and testosterone levels is really important. And just having a little look at your sleep and diet and overall stress. One of the best things you can do is kind of in your 40s make life as simple as you can. And I sort of always say that with a giggle, because I don't know what 40-year-old person in their 40s can make life simple with work or family commitments or everything. But I think when I say it, I mean there's stresses we can get rid of and stresses we can't. But it's not a time to go, I really want to do an MBA right now on top of my family work and this, just trying, once you've reached menopause, you've got this time and energy to really get into doing things. But I think it's time to reduce down stress. I think sleep's huge. And I think we have so many people that have sleep issues that probably don't even realize because they've had sleep issues for such a long time. But protein, eating lots of protein, focusing on protein. There's so many things that you can do, and it's not all, supplements and hormone therapies and those kind of things. You can just really simply start addressing some of your lifestyle.
Mm.
And if you do it, the earlier you do it, you can just focus on one little bit so it's not so overwhelming, because everyone knows what we should be eating or how we should be exercising. It's a matter of just getting it to be easy and maintaining it in our lifestyle. So just you can focus just on one little part and start doing that until that feels good, and then doing the next bit.
Yeah, I love the topic of strength and even bone density in women, because I did a podcast earlier, very different topic, but with on eating disorders and how the heavily restricted diet is now, years later, having such an effect on injury and how she recovers and heals, or how people recover and heal. And it's just such an important message that, yes, strength, muscle strength, bone density, it's nothing to be, it's so important. We shouldn't just be kind of flipping over this. And there's such an expectation on women to look a certain way, and we all want to be slim and, you know, follow particular diets and whatever else. But I guess fundamentally you have to give yourself the best shot of dealing with all the things life will bring. Even if you've got a healthy life, you know, a healthy trajectory of health, even dealing with menopause, those fundamental basics you have to pay such close attention to, with protein and, just checking all your levels through blood tests, and then monitoring and changing your lifestyle to make sure that, you know, you're in a really healthy space.
Totally. And I think even just the exercise that we do when we talk about weights, when I have this conversation with patients about sarcopenia, which is muscle loss, and osteoporosis risks, and they say that, "Oh, I do a lot, I do Pilates," and Pilates is amazing. It's a really good form of exercise. I love people doing that, but it's not the kind of exercise that actually helps bone density whatsoever. You know, you need really heavy weights, short reps of heavy weights. So I think even just understanding what actually the best exercise for each area is.
So we're talking like dumbbells.
Yeah,
We're talking like weights.
yeah, weights. Yeah,
It's so good
um,
though. I think I would say a lot of women are scared to build muscle because it doesn't fit the body that they think they want. I used to
exactly.
be one of those people, absolutely. However, as with every year I get older, weights are amazing for, first of all, toning, keeping you fit, but also the endorphin hit that you get after a weight session. And then the pride factor of, last week I lifted 4, you know, 2 weeks later I could lift 8. Like, just to see that incremental development does so much for your confidence. It's
Totally.
incredible. Like, weights are nothing to be afraid of. They're the opposite.
And women, you know, you're generally not going to you're not going to look like Arnold Schwarzenegger by doing it. You know, it's not that bulking. It's very toning and really helps with your metabolic rate. You know, the more muscle you have, the better for your metabolic rate as well. So yeah, again, I think you're right. It's got a bit of a negative connotation, but it's so amazing and very important.
One question I always have is, because everyone talks about the importance of sleep. Is it, if someone is run down or they're feeling burnt out, is it better to sleep or to get up and do exercise and get that endorphin hit, you know, look after yourself that way? When is it better to sleep, you know, if in those, do you know what I mean? In those
Yeah,
times where you're like, I just need to
great
sleep
question.
in. But it's better to get up and because I always say, just do the exercise. And then I'm tired. I'm like, maybe I just need to chill out.
I think it can be a little bit case dependent, and how, you know, if it's just a one off versus, you know, a week of no sleep. But there's a great saying of, you know, waking up early and not getting your right amount of hours sleep to exercise is like jumping over a $50 note to pick up 50 cents.
Yeah.
So sleep is so
Yeah.
important. You know, we obviously want to have exercise, but
Oh,
whether that
I
means
think I've
going to
lost you.
bed earlier so that you can wake up earlier to do it. But the sleep is really, really important for women, for sure. It's a struggle because we've only got so many hours in a day and we've got so many things to do. But I definitely would say, particularly for women in 40s, that sleep overrules.
And with sleep, if women are, or men are taking sleep aid, so melatonin or a sleeping tablet or antihistamine or something,
Mm.
does that, and they're sleeping well, is that good quality sleep, or should the goal really to be to strip all that out and just to find ways to let
Mm.
your body naturally fall asleep and stay asleep?
I think ideally, to know that your body's doing what it's supposed to be doing, not having to use any of it would be my number one.
Mhm.
Number two would be, I mean, you can still use, there's beautiful sleep magnesiums and those things. That's absolutely fine. But for two, I don't mind using some melatonins. For some people, as you get older, their melatonin does reduce. Um, it again, I try to get your body to do it itself. So it might be that you get out of pattern and you use it for a couple of weeks to get yourself back into a pattern, and you come off it. But it's not as bad. You still are getting good quality sleep. Sleeping tablets, I don't think are great. Um, Again, if people are on them, I try and say, why don't you use them every 3 to 4 nights? Because generally, I feel like you can have two or three, maybe not so great nights before you just absolutely
Mm.
hit floor. So if you say you know that you could maybe have 2 nights of bad sleep, but the third night you can use something to help so that you're kind of recharging. But it's not great quality sleep, and so I prefer that that's when we try and look at other ways of improving the sleep quality.
Yeah, something I think I get sucked into is far too much phone, like blue light
Mm.
before bed, and it is like a direct effect. If I'm doing that and going to sleep, I'll be awake within 3 hours, and my mind will be like, "Ah." But if I read, or I don't, yeah, if I read, then it's very, very different.
It's really back to basics. It's from 7:30 turning off overhead lights and using floor lamps or table lamps, because your body starts to look at that, angular light like the sun's going down, so it
Oh
starts
yeah,
putting it there. Having a hot shower before you go to bed, just going to bed, without any screens. Um, Magnesium is amazing. There's so many things that you can do that don't involve a sleeping tablet. It's just that sleeping tablet seems to be,
quick and
easy.
easy. Mm.
Yeah.
So, in with your history of working with so many women, what would you say are common pain points when it comes to women in their late 30s, early 40s who are starting to notice signs of potentially going through perimenopause? What are women struggling with usually, and what something you found helps, if it's diet, supplement, anything else?
I think the main group of people in their early 40s, it's that group that don't really know what's going on with them.
Mm.
So it's not clear hormonal problems. The most common things are the anxiety, the losing confidence in themselves, feeling overwhelmed. They just say, I don't recognize myself. I don't recognize my body. I don't recognize who I've become. So it's that really general kind of stuff.
Mm.
And the best thing that we can do at that time is really focus on trying to boost your progesterone. And there's lots of ways we can do that. So we can reduce stress. And again, when we remember, stress isn't just, oh, I'm stressed. So eating well, cutting sugar and refined carbs just makes such a difference. It's really hard to do for a lot of people because they are addictive. The more you have, the more you want to eat. So we start to work on that slowly, starting to cut out and putting in lots of more leafy greens and other veggies to make you feel full. So then reducing stress. Often I'm actually getting people to exercise less at that time because they're often
Mm.
trying to lose a bit of weight. So they're exercising more, and it's about calming it all down. So for a little while we're just not going to exercise as much, go for some gentle walks, be out in nature, try and calm yourself down. But then there's lots of supplements we can do to boost that progesterone as well. And this is the same for PMS. So for younger people that suffer from PMS, that's often a low progesterone. So we can use, high doses of vitamin C. I use about 1,000 milligrams of vitamin C a day. You can add maca into the diet. But a common herb that works really well by indirectly boosting the progesterone is Vitex or chase tree, and that's really common herb that you can just get from the chemist. There's an over the counter medication supplement, and that works beautifully for
Mhm.
these low progesterone kind of symptoms. But then if we're really struggling, or if someone's a bit closer to reaching menopause, we can actually give hormones. We've got beautiful body identical hormones that we can use now. It's not like the old days where they were foreign to our body and causing all sorts of horrible side effects. We can use body identical progesterone and take it from day 15 of your cycle until your period and just get rid of a lot of that. It's a bit of a wonder drugs. It's like taking a Valium. So for those people that are taking temazepam or another benzo, they often find it really easy to swap over just to taking progesterone.
Wow. So all those things you mentioned, like not feeling like yourself, anxiety, not sleeping well, I can understand how someone might think, oh, it could be depression or it could be this, and give you an antidepressant. So is that a common misdiagnosis?
Majority, yes, totally. So most of the people that have come to seek out my help are because they've either been on antidepressants and it's maybe worked a little bit but not really solved all the problem. It might have helped the anxiety, but they're still not feeling themselves, lost confidence. Or they've been told that that's the only option and they're kind of not quite happy with that and trying to look for other options. And it's really interesting as well that in the 40s, there's a really common diagnosis of fibromyalgia, and that is where you get body aches and pains and associated with low mood and depression and anxiety. And the most common treatment for that, it's a bit of a label that people get, so they think that that's what they've got for life and they get put on antidepressants. But body aches, one of the signs we've just talked about being one of the signs of perimenopause and low mood. So I think it's really, really common misdiagnosis, and we can just really do so much good with manipulating the hormones either through diet, lifestyle, supplements, or actually using the hormones.
Do women, because I've taken antidepressants for over 10 years, I have a feeling that I'll take it forever, but is it something that when you do introduce hormones later in life and you go through perimenopause, menopause, is that reassessed, or do you just, obviously they're two different things, but
everyone, that's a really individual choice, and I think I always give that power of choice to the patient. So some people are really keen to come off, and I'm always like, don't come off yet. I want you feeling the best you've ever felt for 6 months before you even think about doing it. And, then also reassuring them that they might come off it and they might still want it. So that's fine. You can go back on it. But it's not, there's not a real, it's a trial and error thing as well. So I think you want to be in a really good space of your life where if you start to struggle a little bit, you can kind of catch it early and do something about it early on. But it definitely doesn't mean that once you're on an SSRI that you have to be on it forever, and vice versa with the hormones.
when you mentioned supplements before, like Vitex and vitamin C, if anyone's heard that and they're going to rush to the chemist and buy it, is it your advice that before doing so, it's always good to see a GP or a women's health specialist just to go through, or can a supplement ever be harmful?
Definitely if used incorrectly or overdoing it. It's not one of those things that the more the better. I think vitamin C is a pretty easy, safe thing. If you're doing 1,000 milligrams a day, we're not going to go into too much trouble with that at all. And again, with Vitex, there is a school of thought that if you have PCOS, that you shouldn't use it. There's two different thoughts on that, and the way I've been taught is that it actually doesn't perpetuate the PCOS, so it should be safe. But if you do have PCOS, then maybe you might want to see someone. Be more seeing a naturopath that specialises in women's health, or an integrative doctor, because this wouldn't be mainstream kind of medicine.
Yeah. I think it's one, because we're in a rush to do everything these days. I feel like sometimes running to the chemist and just buying all the things, you're like, I'll be fine. But sometimes, like you said, getting your bloods checked. And on that, with the insulin, the fasting insulin blood test, do you recommend that for women in their early 40s, or when women feel like they could be perimenopausal, or just any time?
Really good to do anyway for anyone. And particularly if you've had problems with PCOS or if you've had gestational diabetes during pregnancies, those sort of things indicate that you've got an underlying predisposition to metabolic issues. So I would definitely be going on the earlier side for that. But at 40, I like everyone to have a bit of a all-over body check with all of those bloods and just check everything anyway.
It's kind of nice when I only started after the birth of my second getting regular blood tests, and it is really nice as you grow your knowledge as to what does what should be, like what the general ranges are. Because as they, that old saying, knowledge is power. When you see your numbers aren't in red, you're like, cool. And then when they are in red and you're out of range, it's so nice to be able to say, okay, so 3 months ago, this was this, and you can really isolate an issue and deal with it a lot faster.
Yes. And I think when we're talking about these, if we're using medications often are quite quick acting. When we're talking about these longer term lifestyle changes, it can be 3 to 4 months before you see a difference. So it can be very hard to motivate yourself enough to keep on the bandwagon because another thing we haven't even talked about really is the alcohol side of things, trying to eliminate alcohol, because that's obviously another big stress on the brain. Trying to eliminate or reducing that, cutting out those sugars and the refined carbs, trying to do some weight training, trying to increase your protein. It's a lot to think about, and it can be really, our society's not geared towards eating that way. It's effort to eat that way. So it can be really hard. Whereas if you've got that blood test that you want to, it's like a test, you're going to study up until that test and see. And then once you start feeling good and you see numbers changing, that really helps that motivation in your body to keep going with those changes.
Oh, absolutely. If I'm a classic for, I love a wine at night to wind down. If I said that to you and I said, what can I replace it with? So I still get that winding down.
Yeah.
Is there something that winds a human down? Like what is it something like breath work?
I mean, breath work is amazing. So definitely, I think that's a bit harder because you kind of need to go and sit by yourself and do it. I mean, you can do those quick breaths of where you breathe in, your stomach expanding a lot, and then really slow exhale. But often it's that time of night where you're cooking dinner and you're maybe if you've got kids, trying to sort them out, get them to bed. So that's the time when people find it hard. So taking yourself off for 10 minutes to breathe isn't as practical. So, I mean, I often actually feel like it's such a mind game. And when I was really trying to cut down that nightly glass of wine, I used to just get a wine glass and fill it with soda water and cut up some fruit in it. And the act of just having a nice glass, did the trick. Or, there's some beautiful non-alcoholic but no sugar kind of sparkling little drinks now that I always have in the fridge. So if I'm really feeling like I need something like that, and it's amazing how it's that habit rather than the actual need for a drink. It's like a treat.
Yeah.
And I think changing our thoughts about what treating a treat is for us. And so getting away, we often have alcohol or food in our society as being a treat, but trying to reimagine what that is.
Yeah, we have this house rule. Well, I have this house rule. My husband hates it. If there's wine consumed, there's no chocolate. If there's chocolate consumed, there's no wine. Like we've got to start to pick and choose a little bit, because the reality is the sleep gets worse. You feel shittier the next day. Everything comes crumbling down. So just starting to eliminate some things, and then just kind of everything in moderation.
And I think you've hit the nail on the head. This is a marathon we're doing. It's about doing it slowly. You're not going to walk out. I always say this, I'm putting down what we're going to aim for, but I don't expect that you're going to walk out of this office and do everything perfectly. But if you know what we're aiming to achieve, you can choose these little moments to kind of just change it and then go on to the next thing. So any little change you can do in a whole year is a lot of change. And I think women are perfectionists, and if we're not doing something perfectly, we think, why bother? So trying to give ourselves a break. And
Yeah.
if you're eating really well and then you have one day where you are just eating all of the chocolate in the world, then that
Mm.
is okay. And then you'll probably feel a bit crap, and that's almost a good indicator going, "Oh, I don't actually feel good when I do it." And so eventually you stop craving those kind of things and you start craving other things.
Yeah. God, you're so right. Women are perfectionists. We've got a lot going on. But
Well,
to finish up, for anyone listening who is in the process where they are, and it's probably a big answer, but just for women who they're on their fertility journey, and if they have frozen their eggs or they've frozen their embryos, and they start to notice they're going through perimenopause or etching towards, if they are, going through menopause and their periods have stopped, is it? Are you able to carry a child during either of those phases, perimenopause, or assume not menopause, but can you?
so definitely not once you reach menopause.
Mm-hmm.
Um, for perimenopause, it depends on where you are in the perimenopause journey. If
Mm-hmm.
you're early perimenopause and you're more low progesterone, you definitely can. You would just need to make sure that we're supporting the progesterone pathways. So
Yeah.
either helping boost it, but actually if you were doing an embryo transfer, you just go straight to giving the progesterone in that luteal phase, or starting in that luteal phase and then continuing it for the first trimester. As you go through perimenopause and you're getting lower estrogen, there's never a never situation. It does get a bit trickier, but I
Mm-hmm.
think that if this was where you were at and you were interested, finding an incredible fertility naturopath.
Mm-hmm.
I work with two of the country's best fertility naturopaths, and it is phenomenal what they do and what they can do and how they can support you in conjunction. And actually, a lot of the obstetricians and gynaes are really open to working with people to support this journey. So it's not like it's a taboo or a one or the other, but trying to get yourself in the best position so that when you do the embryo transfer, your body is ready it's really empowering as well because you're taking charge and doing something.
So, for those who just heard about your working and your colleagues, are you referring to Floralia Wellness?
Yes,
Yeah,
yes.
I will. I've been there myself. I had Hashimoto's after my second, and it was just so game changing to have such an acute focus on that particular element of my health. And it was phenomenal to come into. I'd never been to a clinic like that. I'd always just gone to the GP, and someone just said, "Why don't you go to a women's clinic and just have the chat you want to have?" And
Yeah.
it made a big difference, huge difference.
Again, I think we're still very tiptoeing around alternative medicine, but it's actually not. It's complementary, meaning it
Yeah.
complements. It's still such a divide, and I think there's a lot of doctors that are really coming around to the fact that medicine does, as I said, disease really well, but this optimization we're still not all that good in, and particularly women's health, we're still a bit behind the times in a lot of our management of women's health issues. So finding someone, and also I think finding a doctor that's open to your
Mhm.
journey of finding someone to help, because you don't want to be hiding that you're going somewhere or that you're taking supplements or that you're doing something, but working together with both angles of Western and other complementary medicines is amazing.
Yeah. There's so much to be said for finding not a good GP, but a GP you have a great relationship with and a lot of trust and confidence in, or just even if you feel comfortable in their presence and you can open up. It's such a different experience than if you're holding it all in and then you leave and you think, I just didn't say what I wanted to say because I felt too embarrassed, shy, whatever else.
And also that you have the time to do it. I know we're so pumped with GPs. I have the luxury of spending sort of 30 to 45 minutes with each patient, which makes such a difference. But in a general GP clinic, you've got 10 minutes to kind of portray everything you want to portray, plus
Mm.
discuss management. So you definitely want to feel comfortable with that therapeutic relationship. But also, I think, taking control of your your journey a little bit as well. And if you want more time, booking a double appointment, and we've got a right to spend time with a doctor and actually be heard, and have a bit of autonomy in our health.
Mm. Well, I could sit here and chat to you for days on end. I find everything you do remarkable and so fascinating, and just I feel so much gratitude towards the area of medicine you've decided to focus on, because women just need more. I think you're right. Men need to appreciate what women go through more. That's part of the process. But I think women are such perfectionists, and sometimes just saying, I've had, not finding, if you're having a bad day, instead of finding the cause, just saying, sometimes it's just your body. Your body's just trying its best to get to the end of the day and keep you safe and healthy. And you've just got to allow your body to do that. And it's really tough. So I think society, communities, the world are really lucky to have people like yourself. So thank you so much for sharing your
Very
time.
much. Well, and to you for having conversations like this accessible to people. It's so important for us just to be sharing conversations, normalizing these conversations, and sparking conversations in between other groups of women. So thank you for doing what you're doing.
I think women are great at talking. That's why I can't wait to link your podcast, because I think even when you hear women discuss things, it can make you feel calmer, because you pick up on something and you're like, oh, I feel that way too. And then you feel less isolated or alone or whatever else. So
and I think,
I will link all of the amazing work you do in the show notes and direct everyone over to you, Dr. Lucy Caratti. So thank you so much for your time.
Thank you. Thanks so much for having me.
It's a pleasure.